Hi, everyone. Welcome to this episode of the COVID series from the 971 podcast. I'm your host, Abdurrahman. Today is a special episode in which we're collaborating with the global initiative, the Students Against COVID. The SAC is a global movement led by students across the world to help do their part in creating a difference in combating the global crisis we're currently in. So joining us today all the way from Baltimore is a renowned clinician and associate professor from the Johns Hopkins University School of Medicine, Dr. Sapna Kudchadkar. Her areas of expertise include anesthesiology, pediatric critical care medicine, physical medicine, and rehabilitation. Dr. Sapna has been an active member of the healthcare force by being on the front lines as a pediatric intensivist. However, unfortunately, just recently, Dr. Sapna contracted the virus herself and was tested positive for it a few days ago. She's currently under self-quarantine at her home in Baltimore. We are truly grateful for you to have volunteered your valuable time for this short interview. Dr. Sapna, before we start, would you like to tell us a little bit about yourself, about your areas of expertise, about your background, and then we'll ask you a couple questions about your experience as a clinician on the front lines and as a patient as of now.
Sure. Thank you. Thank you for having me, first of all. So my name's Sapna Kudchadkar. I'm a pediatric anesthesiologist and intensivist at Johns Hopkins in the departments of anesthesia, critical care medicine, pediatrics, and physical medicine and rehabilitation. So I am a board-certified anesthesiologist, pediatrician, but I spend my clinical time, half of my time anesthetizing children in the operating room, and the other half of my time in the pediatric intensive care unit. So my research interests, as you already mentioned, are focused on ICU rehabilitation and the impact of rehab and sedation and ICU liberation on outcomes for critically ill children. So it's a pleasure to be on the show. Unfortunately, under these circumstances, but I'm really excited to share with you some of the perspectives and experiences and learning that I've experienced as a part of this process.
That is really impressive. Like having both anesthesiology and pediatric critical care medicine. That sounds really cool.
It's fun. It's fun, and
Yeah.
the reason I love it is because taking care of critically ill kids is obviously is emotionally taxing, and it's really fun to take care of healthy kids from time to time, and that happens in the operating room. But another reason is because I also get continuity of care with my critically ill patients, and I actually have the opportunity to take care of them in the operating room when they need surgical procedures or other interventions, and then follow them back. So it's really the true perioperative home, which is great.
Yeah, for sure. So I'm just going to be asking you now a few questions about the current crisis we're in. So when did you first hear about this virus? And did you actually predict that it would become a global pandemic?
Great question. And I think all of us should take some time to reflect on that. We all think about times that we heard about some big thing that's happening, but this was very different because you heard about it happening in a completely different continent, in a completely different country, and you knew that. So I think the first time that I started really hearing about it was probably December through January. Just hearing about it on the news and hearing about the reports that were coming out from China, but at the time it seemed like it was an issue that was contained, and that it was unfortunately something that the people of Wuhan were dealing with, and it was catastrophic and devastating. But you were watching it from afar and hoping and praying that things would get better there. At the time, I don't think I had any. I did not know that it was possible for this to reach the level of pandemic that it is now and will continue to be. I definitely didn't anticipate it by any means.
Yeah, these are truly unprecedented times. I don't think a lot of experts could have predicted this just a couple of months ago. So,
Right. Yeah, and I think there's a lot of controversy about how much we did know or could have known or could have predicted. So it's like a day-to-day fight, right? And every day it's changing. And I think what's really striking to me is, at least in my lifetime, there's never been one event that has impacted everybody, every single person you know in such a major way, right? Everybody is now living a completely different life than they ever imagined. And it's impacting everyone across the world. It's a shared experience that I think is very unique and most of us will never see in our lifetime. So this is just, it's unprecedented, like you said.
Yeah, definitely. How did it feel like being on the front lines and such a high risk exposure? Like, what was the aura around the hospital in anticipation of this whole epidemic that was coming?
Yeah, I think that's a great question. I knew going in. So when I was scheduled to go on service in the ICU, I'll kind of take it a couple weeks back. So my week of service in the ICU was started on the 10th of March. So right before that, things had really started to ramp up in the United States, and we were starting to recognize that things were going to be bad, and we had already started some of the domestic travel restrictions for employees of hospitals, for example. I actually had 3 visits to give grand rounds to implement my rehab program, Pick You Up, in different hospitals. I was scheduled to go to Riley Children's Hospital in Indianapolis and Cardinal Glennon Children's Hospital and Boston Children's to do another webinar. And all of those got acutely canceled because our hospital told us that domestic travel was restricted, appropriately so, and all of the other hospitals were starting to close down their group learning, like grand rounds, et cetera. They were starting to transition to online learning. So I briefly was introduced to all of the social distancing measures that were happening. But then to be on service that first Monday, the aura in the hospital, at least in the pediatric ICU, was not too significantly different. We were all cognizant of social distancing guidelines, trying to keep our distance from each other, trying to make sure we cleaned, the phone. If someone wanted to help you answer a phone call, if you were busy cleaning the phone or wiping it down prior to handing it over, wiping down keyboards. There was extra attention to those things. But since we didn't have a COVID positive patient in the unit yet, there was only preparation. So we were planning on what would happen if a COVID person under investigation came in, or a child who had a respiratory illness that was not otherwise specified. The other challenge at the time is that when patients would come in and they were potentially considered to be a COVID patient, we were evaluating them for all other things first. COVID was more of the diagnosis of exception, because we all know that things like flu and RSV are much more common in children. And we also know that children are significantly less impacted by COVID. So we were all aware, we were taking measures, but it didn't really officially hit until actually one of our healthcare workers was infected.
Could you maybe take us through a timeline of your symptoms? How did they start? And
Sure. So I believe that just to give you kind of days to give you we believe that my exposure probably happened on a Tuesday or Wednesday. And by Friday, I was starting to have some myalgias. So my muscles were aching. I felt a little bit more tired, but it wasn't anything out of the ordinary from, being on for a week of service and just being tired and having long hours. So didn't really think much of it, especially because I didn't have cough or fever or any of those kind of classic symptoms that at the time is what we were originally thinking was the first thing that you would eventually have. So I was concerned, though, because with the myalgias, I just learned that one of my colleagues had come back positive, who I'd been working with closely. So I advocated to get tested. I got tested the day after my symptoms started. I didn't go back to work that day. Someone covered for me. And by the time my test came back positive, I had already started coughing and having low-grade fevers. So that was day 3 of my symptoms. And then progressively after that, I did get very tired. And the interesting thing about the symptoms is they're very, very intermittent. So you would wake up in the morning feeling pretty good, and then it would just hit you like a ton of bricks. And then you just felt like doing absolutely nothing, and you just wanted to sleep or lay down. And you just felt this like malaise, and the cough continued. My eyes were burning quite a bit, which was something I didn't anticipate. And then on day 4 is when I lost my sense of smell. And that was very surprising. And the day that I lost my sense of smell is one of the first days that the news reports had started to come out about anosmia as a symptom. And I didn't realize I had it until I kept pouring scented oil in a diffuser, and I couldn't smell anything. And I was getting so frustrated. I was like, "What is this diffuser oil that I bought?" And then a friend asked me, "Are you having loss of smell?" And it hit me at that point. And the loss of smell persisted for the next 4 to 5 days. So now I'm day 11 of symptoms, and my cough luckily has abated. I haven't had fevers for 8 days, and I'm just intermittently a little tired, but overall feel like I'm just recovering from a bad flu, for example. But overall, I'm feeling pretty good. So that's kind of the course of my symptoms.
Okay. Yeah, actually, the anosmia, that's something that's very interesting. I was reading some papers about it in terms of pathogenesis, and they're still trying to figure out what exactly causes the loss of smell.
Correct.
So I feel like that's something that should definitely be more looked into.
Yeah, and I saw a case report today actually that they're starting to think that the cranial nerve involvement is actually just part of it. There was one patient that recently was tested positive, and obviously they have to learn more about this, but had some evidence of trigeminal neuralgia.
Yeah, I read about
So
that. Yeah.
yeah, so there's definitely things emerging. But I can tell you that the sense of smell also comes and goes as well. I mentioned that the symptoms are intermittent, so there were periods that I could smell a little bit, and then it would completely disappear again. So there's something about the olfactory, either epithelial, nerve endings, that they're learning more and more about. But it's fascinating. I don't think any of us ever really thought about our sense of smell that much before
Hmm.
before COVID-19. So we're learning a lot more about that sense for sure. And my sense of taste was also diminished, but I think that was more because my sense of smell was gone. I'm not sure that my taste was independently affected. It's just food just didn't taste good at all because you couldn't smell anything. So something we take for granted.
Yeah, absolutely. Um, Now that you're like in self-quarantine isolation, how do you keep yourself distracted? Like at home, what activities do you do?
Yes, it's really been the hardest part of the whole thing is been isolated. I mean, I think you can probably tell I'm a bit of an extrovert, so it's definitely I learned I'm definitely an extrovert because this has been a
Hmm.
really challenging time in my life. But I have occupied myself by doing some reading. I've been able to read books, which I generally didn't have time to sit down and do. I also have found creative ways of engaging with my family. My whole family is still in the house. They're living on the bottom floor, and then I'm upstairs. And they come and they bring me food and deliver things to me outside on a tray, and I grab it when they've gone back downstairs. I read books with my kids and help them with homework. We're doing a lot of homeschooling now since everyone's out of school. So I actually use a lot of Zoom, not only to have work meetings, and I'm trying to stay engaged and busy and going to conferences and keeping involved in all of those educational activities that they're maintaining at our institution via Zoom. But I also Zoom with my kids. So, for
Hmm.
example, my daughter, when she pulls up a book that she's reading on her Kindle app, and we read it together, or we play Pictionary, or we do things that engage. We do a lot of online games together. And so that's definitely, and then social media obviously is another, that's how you guys found me. And that's
Hmm.
another way that I'm staying engaged. I'm trying to share my experiences, which I think is really important because there's a lot of people who are suffering quietly, who maybe don't feel comfortable sharing their stories or don't want to talk about things publicly. And I felt it was important, since it's a forum that I feel comfortable in, to share my experiences for as one person who has very mild symptoms. The mortality rate is devastating, and people have very severe disease, but there's still a lot more people who have very mild disease, and I wanted to make sure that that got transmitted, and that people have that information, so that there's both sides of the coin, right? We're seeing the really horrible stories and the horrible cases, and we all have to be prepared to take care of those patients on the front lines. But we also have to be aware that there are many mild cases, and that staying at home really is the only way to prevent community transmission, even from people like me.
Yeah, I feel like that's a very important point you raised, especially because right now, this is all over the news. It could be quite overwhelming at times. It's all over social media. There's a lot of anxiety, no doubt, because most people are at home in self-quarantine. So you start overthinking all those thoughts, and your phone is not helping either. So I think it's very important to, in a way, this pandemic has revolutionized distance learning or online communication. But yeah, at the same time, I think at this point it's very important to not lose hope, and because it could be very easy to slip into that black hole of negativity and pessimism. Yeah. Doctor, would you say that this virus threatens only elderly people? What are the risk of complications amongst the younger population?
Yeah, so I don't want to quote, the data continues to build and grow, right? Clearly that elderly and people with significant comorbidities are at higher risk for having complications and worsening of disease, to having shortness of breath and things that would require you to go to a hospital. Early on, it was the conventional thinking that, that children were pretty much unaffected by this, and that even younger patients, younger healthy patients, weren't at risk of having worsening of symptoms. However, it seems that the numbers that we're seeing, not only in Europe, but in the US and emerging from China, is that this is a disease that can absolutely have severe disease manifestations in younger patients. Not necessarily many children. We're actually collecting data through, there's a website called myvps.org, which is a dashboard of all COVID across United States PICUs, pediatric intensive care units. And fortunately, it seems that COVID definitely has a very low incidence in the pediatric population. We do have some positives across the U.S., there's no question, but compared to the numbers in adults, it's not nearly as high from a proportion perspective. But we are hearing stories, no question, across the board that young patients are impacted. And that's why it's been really hard to watch a lot of kids going out and still continuing their spring break activities and, going to the beaches. And I think everyone's seen pictures on social media of crowded parks and beaches and crowded public areas that people still sometimes feel like they're invincible. And there's definitely evidence to support the fact that no one is invincible, and just taking good care of yourself, doing everything you can to protect not only your family members who are elderly and high risk, but also yourself, is very important.
Yeah, absolutely. I feel like precautions are always necessary. So social distancing, staying at home, because it's not only about you getting sick, but you passing on to other people that might be more vulnerable.
Unknowingly, correct.
All right. Do you think we have reached the peak of the pandemic yet? And if not, how long do you think this will last?
I don't think we have, unfortunately. I can tell you, for example, even in Baltimore and in Maryland, our numbers are continuing to rise, and we haven't reached nearly the numbers that or the impact that New York City has, for example. But there is a concern that we are going to get there, and that we're just behind in the timeline. So that being said, I think that there are going to be several cities across the U.S., I can speak specifically to the United States, that still haven't seen their peak by any means. And that I know this is an optimistic estimate, but I believe we're probably going to see the peak, at least where I live, in the next 2 to 3 weeks. and within the next month. But if everybody continues to do what they're supposed to do, in Maryland, we just had a stay-at-home order put in place by our governor last night. So it means that you are not supposed to leave the house unless you are doing outdoor exercise, using social distancing, or going to the grocery store or the pharmacy, essentially, like any very essential activity. So the streets are now completely empty. And hopefully, if everyone continues to do their part to flatten the curve, my hope is that we'll start to see some relief in a month. But that, I think, is a very optimistic estimate. We're probably looking closer to mid-May, end of May, and even potentially longer. So it's not clear yet, but I think a month is an optimistic estimate.
Yeah, let's hope like this passes as soon as possible.
Absolutely.
As long as we just take our precautionary measures, trying to flatten the curve, stay at home. I think these are the key factors, as you said, in tackling this.
And one thing I did want to add is that for those of you who are listening out there is don't ever feel like you can't say something to someone else about what you think is the best thing to do. I can tell you I've probably sound like a broken record, and maybe it came off sounding a little preachy or like I was telling people, bossing people around, but I've been very forward to tell people when I think that they're doing something that is putting them or their family at risk. And I feel as medical students, trainees, providers, staff, this is what we do. We have knowledge of what makes things worse and what could make things better. And it's our job to educate the public. We can't rely on the news and governmental leaders to do that for us. We are the best people to educate our friends, our family, the public. And I think the more we speak out, the more impact we have. And so even if you see someone going out to do something that's non-essential and isn't a necessity, or you see people getting together for a party, that's the time to say something, because even that little comment that you make in a respectful way, in a way that's looking out for someone, could make a huge difference for hundreds of people, right? So I think that's one thing I wanted to emphasize.
Yeah, I agree. I feel like we all have a part to play in this global crisis. We're all in this together. So each person makes a difference.
Definitely. And even I look back on the things that I feel like I did right and the things I would have done differently. So things that I feel like I did right, and which is why my entire family of 7 people are all healthy in my house right now, is when I was on service and I knew I was at risk, I followed all the, I made sure I wore different clothes to work than I did at work, and I changed before I came home, and I didn't touch anybody until after I had taken a shower and washed my hair, and didn't bring my shoes inside the house. And I was cognizant that this virus was out there and it potentially was on me, on my things, and so I wanted to make sure I did everything I could to not bring it home. And I know a lot of healthcare workers, like, I don't know if you've seen the New Yorker cover that's coming up. It's really, a lot of healthcare workers are not only anxious and nervous about what's happening at work, they are also very anxious and nervous about bringing this virus home to their families. And there's a lot of things that we can do to protect our families and protect our patients and each other. And I think taking all those measures, you can't do too much at this point to be careful.
Even for us, like 2 weeks ago, I'm actually doing my internal medicine rotation right now. We had to take so much measures. Whenever I would come home, I would leave my white coat in the car. I would always make sure that they're washed separately. So we all were given directives by the hospital, by the university, in order to prevent the spread of the virus.
These are easy things to do, so we might as well do them. And I think probably it's changed how we do things moving forward too, right? Like probably there's some change in practice that's going to occur. We won't know that for several months, how once life does start to return to normal, how we will all change how we do things down the line. One of the interesting things now is the vast majority of ICU rounds, for example, at Johns Hopkins are occurring via Zoom. So there's this, if you go into an intensive care unit, the hallways actually may not be that busy depending on how severe the patients are, but we're all doing distance rounding so that we're not all huddled in hallways together, potentially increasing the risk to each other. And so, you know, I think we're learning that there's a lot of things we can do via distance learning. I don't think anyone would ever advocate for doing distance rounding for the rest of our lives, but
Yeah.
there might be components of that maybe we could potentially transition to distance and online to decrease infection risk across the board and still optimize patient care and family engagement. You know, I think we have a lot to learn about what the next phase of ICU care specifically is going to look like.
Definitely. I feel like we have this event will impact like all of us as global citizens for the entirety of our lives, because this is something that's probably like a once in a century public health crisis.
You hope so, right?
Yeah,
I hope it's
yeah,
a once in a century public health
yeah.
crisis. And I think hopefully we've all learned a lot from this, and hopefully we can prevent something like this from happening again once we actually get through this ordeal.
What message would you like to give to students around the world? I was actually reading this statistic the other day. Right now, 1.4 billion students are at home. That's like 80% of the world's learners,
Wow.
which is absolutely huge. And especially us as medical students, when this whole crisis started, we felt quite helpless in a way. We didn't know exactly what to do. So,
Right.
what message would you like to give to students around the world globally?
I love that question, and I've been thinking about this a lot because I think a lot, and it's not just limited to medical students, but I think a lot of people are feeling helpless. They feel like they're not able to advocate in the way that they would normally, and that they're not able to be an integral part of patient care. For example, for the medical students, the third year medical students who normally would be on rotations right now, like you were saying, it's really hard to all of a sudden be at home and be doing distance things. And it's also hard to stay motivated because you're so distracted by kind of the gravity of everything that's happening across the world. So my biggest advice is to take a step back, try to clear your mind from social media and the news, and make a list of the things that you would like to potentially accomplish during this time, and think about the things that how you could get involved in advocacy. For example, what you're doing right now, I think is an amazing thing to do for students across the globe, and to get involved and educate. You guys are the foot soldiers of education, because if you can't be on the front lines because your hospitals have said you can't be on the front lines right now because they don't want to expose you, then you can do as much as you can, social media, online, to educate the communities. And getting out there and getting your message across as much as possible in any creative forum, I think, is really key. And then potentially thinking about new and interesting research opportunities that you can get involved in. There are many faculty out there whose research is still continuing, even though they may not be able to have direct patient interaction. There are potentially ways to get involved in research. So seeking out opportunities within your institution, seeking out faculty mentors that you trust and who have been engaged with you to ask for ideas of how you can get involved in the COVID response, even if it means that you can't be in the hospital with the patients. What are ways that you can help? There are several medical student organizations that are helping with procuring PPE. Going to different locations to pick up PPE from donation sites. That's one option. There's also many medical students, and I have they're hearts of gold that are helping frontline providers with childcare, and who really are out on the front lines, making sure that the frontline healthcare providers can be in the hospital and not worry about their family needs.
Yeah.
And so I know that's another way. I know not every medical student was looking to babysit, for example, but it is one way that some students are giving back and getting engaged and feeling like they're making a huge difference, which they are. If you can imagine a two ICU physician family, how are they going to manage childcare in a situation like this? Then not everyone has good solutions, and you definitely can't send your kids to be with your elderly parents who are at high risk and have that potential. So there's a lot of different ways, but be creative. Don't get sucked into social media for all the negatives. Look for the positive stories. Look for the good things that are happening, because we can all learn about the goodness in the world, I think, is what I'm trying to train myself to do, because it's easy to get sucked into some of the negatives, but there's still a lot of positives out there.
Thank you so much for those words. I think they were really needed, especially for us students to hear that. In these times of uncertainty, these are hard times. So I feel like all of that you said was really important. And because we all want to play a part in creating a difference in this crisis we're facing.
Absolutely. And
yeah.
Can I just add one thing, Abdul? Also, I think a lot of I teach medical students at Johns Hopkins, and I think one of the concerns is that some medical students are hesitating to reach out to faculty members and physicians because they don't want to, quote unquote, bother them during this time, and because we must be so busy. Still, please reach out. We still want to hear from you. And even if we don't get to the email or expeditiously, it's there, and we'll respond as soon as we can. And don't assume that everybody is on the front lines all the time. We do get breaks. There are physicians who are working primarily from home because they're not involved in the COVID response directly. They may be doing telemedicine, telehealth. So don't assume that all the physicians that your faculty members are busy right now. They might be busy, but we still want to engage with our students. And I'll be honest, like yesterday, I spent all day, and today, after we're done, I'll be on meetings with my medical students, and that brings me great joy. And that is the ultimate wonderful distraction for me to continue to further their education in meaningful ways and not focus only on COVID and the pandemic. Life is going on, and I think that's an important take home.
Thank you so much for being with us today.
Absolutely.
It was a great pleasure having you. I just want to raise a point here that about how grateful we are to healthcare workers like yourself around the world who are risking their own lives in order to save others. It really means a lot. So thank you so much. We totally appreciate it. And you truly are our heroes. Yeah.
Oh, thank you. And you guys are heroes as well. And I'll take that message when I transition into being an adult intensivist in the coming weeks. So I'm being deployed to work in the adult ICUs very soon. So thank you for those kind words. I'll share them with everyone that I know. And I really appreciate chatting with you.
Of course. Is there anything else you would like to add or say?
No, I think just keep up the great work. You guys are amazing advocates, and please continue to educate out there and keep your chins up. You are the future of medicine, and we're going to need you. So please stay in the fight.
Thank you so much. We wish you a speedy and full recovery. And
thank you.
Yeah, thank you so much again.
Take care. All right.
Take care. Bye-bye.